I'm Firoz Mienji. I'm a pediatric spine surgeon, and I work at the British Columbia Children's Hospital in Vancouver, Canada. So vertebral body tethering, it's a new surgical procedure in which we're trying to harness the patient's available growth so that their deformity doesn't get worse over time, and we also try and get some correction by using that growth that they would have available. So the way VBT works is we actually place a tether, it looks like a little rope, on the front of your spine. We anchor that with some screws that's placed in the bone of each vertebrae, and we do it on the outside of the curve so that the inside of your curve will grow straight over time as the child continues to grow. So what the rope is doing is whenever you have, say, a curvature, if you put the rope on the side where it's curved, then the inside continues to grow. So the rope, all it's doing, it's holding the area of the outside of the curve under tension, so the inside will just continue to grow. So it's effectively like taking a tree and modulating its growth by putting a rope with some sticks around it and to grow in the direction you want. And that's why the implant doesn't come out. It actually is helping you to grow in the direction that we want you to. So the early results are actually quite promising. We've certainly established what we call proof of concept, is that it is working. We've also faced some challenges and are now identifying that it's not actually for all patients that have scoliosis, but we're refining those patients that would benefit from the new technology. So some of the benefits of tethering, number one is that it is potentially providing a fusionless option for correcting a spine. And in deformity surgery, we've always been, unfortunately, having one surgical option, and that's a fusion. And we do have some concerns of the long-term implications of the fusion. So the number one benefit, I would say, for tethering is to allow that spine to remain mobile. The benefit of vertebral body tethering is to provide a fusionless option to help prevent the deformity from getting worse and also to obtain correction of that deformity. We're doing that obviously with a rope, so we're not putting rods in the spine and making that spine straight and holding that position. We're trying to maintain some mobility between the spinal segments with VBT, so that's the number one benefit we're having. Well, what we're trying to do is not do it in curves that are too small or curves that are too big, and also we're looking at what growth the child would have available. If they're too young, then there can be some issues with operating or giving this technology on a very young child, and we're not trying to do it in somebody that's too old. So the best thing to do would be to connect with a surgeon who has experience in vertebral body tethering, and I think they can outline if this is an option for the patient that's looking for this technology. So the tether does stay in definitively. We generally don't recommend to go back in to take the tether out. So does it stay in for the rest of your life? At this moment in time, that's the way the surgery is done. It's implanted and it modulates the child's growth, and you see the spine getting straight over time. The way I see tethering and why it's very exciting, it's basically like taking somebody that had arthritis in their hip and knees 30 or 40 years ago. At that time, you fused the joint to allow that patient to move around and not have pain. Nowadays, you wouldn't hear of that. You always get a mobile joint. So motion in orthopedics or in spine has been very important. And now with this new technology, we may be able to provide that for patients with spinal deformity. So it's very much a huge leap forward. But of course, we have to move cautiously to make sure that we're researching this, we're looking at outcomes so that we provide it for the ideal patient.